Hi, I'm Tonya Bauer, and I'm a producer for the NBC News Health and Medical Unit. And today at NBCU Academy, we're going to go over what I do as a medical producer. The medical unit covers, as you would expect, health and medical news across all of NBC's platforms and properties. Our unit is comprised of a few television producers, digital editors, and reporters, and then we even have a few doctors. And our big goal is to create compelling medical content and tell stories and really drive the editorial of our subject matter across NBC. A few of the things I do as a producer are what we call tape spots, which are the stories you see on nightly news that Lester Holt will introduce.
How exactly does sunscreen work and why do we need it? Our pal, Dr. John Torres, explains.
And that includes pitching and researching, going into the field and doing interviews and shooting video. It also includes writing the script and then going into edit, working with an editor to piece all of it together. The other thing I do is crosstalks, and those are the Q&A you see often on the Today Show between an anchor and a correspondent, or in my case, Dr. John.
What can scientists, what can the vaccine companies, what can our government do to reassure folks that these vaccines are going to be safe?
And that also requires finding video elements and doing graphic, as well as coming up with the questions and some bullet points for answers. I also work with our digital team, and I do a lot of our social content. So we do a lot of Facebook Lives where we answer medical questions. We launched a series during the pandemic called Doc to Doc, where Dr. John interviews prominent medical experts just about the medical news of that week. We start our day with a morning editorial call with my team, and everyone goes around and says what they're working on. And then it's a matter of, am I on deadline that day for a story for nightly news or the Today Show? Do I have an idea for a pitch? So then I need to, do some research, make some calls, reach out to some of my contacts at hospitals. Am I editing a story that day? Then I have to hop on the phone with an editor, make sure I give them all of my interviews and my video and the script, and have the anchor track, so put the script to voice. And then other days, it's in the field. You are at a hospital or with someone at their home talking to them about their experiences. One thing I really enjoy about my job is having a beat. I really like being immersed in this medical world. And it really leads us to a lot of great stories and a lot of great people. So for instance, one of my favorite stories I worked on, it took 3 months to do. It was called, What If You Call 911 and No One Shows Up? And I read about this small EMS service in my home state of North Dakota that was closing. And so when you think about an ambulance center is closing, that doesn't sound great. I looked into it a little bit more and found out it wasn't an isolated incident. And it involved a lot of research, a lot of phone calls, and a lot of data. And we took a trip out to North Dakota. We filmed there for a few days. We spoke with a lot of people on the phone, and we ended up running a quality story on NBC Nightly News, and then we did a very big digital feature on NBCnews.com. We interact with doctors and nurses and researchers all the time who are just doing amazing things. It also leads us to a lot of people who are going through medical experiences, and you really see their resiliency, their braveness for not only fighting or going through something, but also then for stepping in front of a camera to share that. It's very inspiring. I started my career in journalism after college by freelancing at a local news station in New York as a writer and an editor. And then soon after that, I landed a role as a desk assistant at NBC Nightly News. And that's the entry-level position at that show. You do a lot of logging, which is typing up interviews, a lot of answering phones, helping producers set up shoots and things like that. And then from there, I rose up and I became a researcher, and then I became an associate producer. After about 3 years at Nightly, the opportunity to join the medical unit came about, and it interested me for two reasons, really. I'd spent my whole career at NBC with nightly news, so I was interested to see what it was like at other shows and other departments. With the medical unit, you get to work with all of those shows. As a unit, you are working with the network shows, you're working with MSNBC, you're working with digital and all of the digital video platforms. So there was a lot more opportunity to produce different types of content, which was really interesting to me. And the second one was that I wanted to know what it was like to have a beat. I'd never really had one before. I'd never really had one topic that I kind of focused on day in and day out. And when you have a beat, you can really dig up some of those stories that you only get by living in that world every single day and having contacts that are ingrained there. So I was really interested for those two reasons. So then I decided to make the move and join the medical unit. So if you have an interest in medical journalism, it's kind of balancing those two things, the medicine and the journalism. So you kind of want to focus on them individually if you can. So you don't need to go to med school, you don't need to become a doctor, but immerse yourself in that world. Read websites that are really geared towards the medical world. There are some specific news outlets that only focus on medicine and biopharmacy and science. So you want to read those. You also can read medical journals. You can learn how to interpret medical studies. All of those will be really helpful in your career as a medical journalist. And then focus on the journalism. Become a good storyteller. Be curious and concise and accurate and creative. And then take all of that and combine the two. You have to know your audience, and then you take all that medical knowledge and you give it to them in a way that is understandable, that is important, that's compelling, and that they can have a takeaway from. I think one thing with all journalism is it's what does the audience need to know about this? What's relevant to that person, to the person watching, to the person reading? And so as a medical journalist, it's distilling a lot of information that sometimes seems like it's a foreign language and giving it to the audience in a way that they can understand and that they can act on. I'm Tonya Bauer, a producer for the NBC News Health and Medical Unit, and hopefully you've taken away a few skills about what it takes to be a medical journalist. Thanks for watching NBCU Academy.